Rickets is the defective mineralization of the cartilage. Matrix in growing bones in children. There are three types of rickets. Nutritional rickets, renal rickets, vitamin D dependent rickets. Vitamin D is required for the normal growth and mineralization of bones. In its absence, instead of growth occurring normally, the osteoblast's proliferation does not take place in an orderly fashion and is not accompanied by mineralization at the normal rate. This results in irregularity in the zone of calcification. The cartilage cells do not degenerate as they should, and ends of the long bones become bulky and soft. There are two types of vitamin D-dependent ricket. Type 1, it is inherited as autosomal recessive trait characterized by defect in conversion of 25-hydroxy-D3 to calcitriol, that is 1-alpha-hydroxylase deficiency. An autosomal recessive trait is a genetic condition that manifests only when an individual inherits two copies of a recessive allele, one from each parent, located on one of the autosome's non-sex chromosomes. Type 2, it is an autosomal recessive disorder in which there is a single amino acid change in one of the zinc fingers of the DNA binding sites for calcitriol receptors. This makes the receptors non-functional. Zinc fingers are small protein structural motifs stabilized by zinc ions that can bind to DNA, RNA, or other proteins. Mechanism of action. Decreased vitamin D results in decreased serum calcium, which results in increased parathyroid hormone, which in turn results in decreased serum phosphate. The effects of PTH and vitamin D have been shown in the figure. PTH acts on the bones to increase bone resorption, and it acts on the kidneys to decrease the phosphate reabsorption. On the other hand, vitamin D increases calcium reabsorption from intestine and kidneys, and also increases the bone calcium mobilization. Causes of vitamin D-dependent ricket. Malabsorption of vitamin D. When the intestines cannot adequately absorb this nutrient, often due to conditions like celiac disease, Crohn's disease, or after certain surgeries. Decreased sunlight, as ultraviolet rays from the sun are necessary for its synthesis in the skin. Poor diet lacking in vitamin D-rich foods such as fatty fish, fortified dairy products, and egg yolks can also contribute to deficiency. Chronic kidney failure affects the conversion of vitamin D into its active form, that is calcitriol. Nutritional rickets is due to dietary deficiency of calcium or phosphorus or both. Renal rickets include hypophosphemic rickets, also known as vitamin D-resistant rickets, because it does not respond to ordinary doses of vitamin D. It has a X-linked dominant inheritance. Failure to reabsorb phosphate from proximal tubules. Increased phosphate wasting at proximal tubule. Dialysis-induced bone disease, often due to chronic kidney failure, disrupts the body's ability to convert vitamin D into its active form, leading to insufficient calcium absorption. Renal osteodystrophy occurs in chronic renal failure. There is decreased calcitriol synthesis. Impaired calcium absorption, and renal parenchyma is lost or diseased. Renal tubular acidosis proximal, type 2, in which the urine pH is less than 5.5. Has increased risk for hypophosphatemic rickets as seen in Fanconi syndrome, because it impairs the kidney's ability to reabsorb phosphate. Venereal features of rickets. Bow legs. Knock knees is a condition where the knees angle inward and touch each other when the legs are straightened. Swollen ankles, knees, and wrists due to swelling of epiphyseal cartilages. Hot cross-bun appearance of head as the fontanelles do not cross properly. Pigeon chest. Ribs give beaded appearance. Teeth erupt late. Deformed teeth. Pelvic deformities. Weakened bones. Tetany. Liver and spleen enlargement can result from the body's attempt to compensate for metabolic disturbances. Coxa vara, decreased hip angle, or coxa valga, increased hip angle. Kyphosis, excessive spine curvature. Scoliosis, lateral spine curvature. Lordosis, inward lower back curvature. Harrison sulcus is a groove in the rib cage due to pulling of the diaphragm inwards. In the early stages of rickets, tetany almost never occurs because the parathyroid glands continually stimulate osteoclastic resorption of bone and therefore maintain an almost normal level of calcium in the extracellular fluid. However, when the bones finally become exhausted of calcium, calcium concentration may fall rapidly. As the blood level of calcium falls below 7 mg/dl, the usual signs of tetany develop and the child may die of tetanic respiratory spasm unless calcium is administered intravenously, which relieves the tetany immediately. Points to ponder. Children who remain indoors throughout the winter are at risk of having rickets due to insufficient sunlight. Rickets tends to occur especially in the spring months because vitamin D formed during the preceding summer is stored in the liver and is available for use during the early winter months. In addition, calcium and phosphate mobilization from the bones can prevent clinical signs of rickets for the first few months of vitamin D deficiency. The plasma calcium concentration in rickets is only slightly depressed, but the level of phosphate is greatly depressed. This phenomenon occurs because the parathyroid glands prevent the calcium level from falling by promoting bone resorption whenever the calcium level begins to fall. However, no good regulatory system exists for preventing a falling level of phosphate. Low levels of Mgb observed in rickets due to impaired intestinal absorption of magnesium. Tyrosinemia type 1 causes rickets primarily due to the liver's inability to properly metabolize tyrosine. This leads to the accumulation of toxic byproducts which inhibits enzymes crucial for vitamin D metabolism. Vitamin D deficient rickets is characterized by decreased serum phosphate 1-2 mg/dl. Increased activity of alkaline phosphatase as the osteoblasts become more active to compensate for deficiencies, resulting in elevated levels of ALP in the blood. The product of calcium and phosphorus in mg/dl is less than 30 in rickets. However, the normal value is 50 in children. Vitamin D is also known as anti-ricket factor. Secondary hyperparathyroidism may occur due to rickets due to physiological compensatory hypertrophy of parathyroid glands in response to hypocalcemia. Rickets is associated with hypotonia as vitamin D plays a crucial role in maintaining calcium levels necessary for proper muscle contraction and relaxation. Lymphocytosis occurs in rickets as a nonspecific immune response to the underlying inflammation and metabolic disturbance. Treatment of rickets. Supplementation of calcium and phosphorus. Administration of vitamin D. A 6-year-old boy had bone deformities such as bow legs and pigeon chest. He had a history of delayed eruption of teeth. On inquiring, the mother informed the physician that the boy had been on a strict vegetarian diet with low intake of milk as well as fats and oils. The following are the laboratory findings of this boy. Strict vegetarian diet lacks vitamin D, and the key points have been highlighted. Mnemonics of some of the features of rickets. Ricketic rosary is a visible swelling where the ribs join their cartilages, and craniotabes refers to the softening of the skull bones in infants. God's plans are worth the wait. Subscribe, like, share, and comment.